I'm Dr. John, 𝙤𝙤𝙘 Physical Medicine. Welcome back to the office. Today we're going to talk about how we treat stenosis at 𝙤𝙤𝙘 Physical Medicine. And we said stenosis is a narrowing of the openings of the spine. And the three most common causes of stenosis we talked about was the disc displacement, the protruded, the bulging, the herniated disc. The second one was a degenerated disc. And the third one was posterior facet syndrome. Now, in those cases, the spine is compressed. So, in my opinion, I think the best treatment for stenosis is the 𝑑RX-9000 non-surgical spinal decompression system. And I'm standing right in front of the decompression, the 𝑑RX-9000. It's a very impressive piece of equipment. Our offices has been doing spinal decompression for 20 years. And all our doctors are certified in it, and we have dual certifications from the developers of the 𝑑RX-9000 as well as Disc Centers of America. The reason why I think, in my opinion, that the 𝑑RX-9000 is the best treatment for stenosis is because it's FDA cleared to treat a bulging, protruded, herniated, or extruded disc. It's actually FDA declared to do that. It's also FDA cleared to treat a degenerated disc, which is also the second cause of stenosis, and it's also FDA cleared to treat posterior facet syndrome, which is a third cause of stenosis. So, in my opinion, we have treated many patients at 𝙤𝙤𝙘 that has stenosis with the 𝑑RX-9000 with really good results. I wanted to let you know and talk about that the decompression, the 𝑑RX-9000, is heavily researched. It's been around for 30 years. Our office has been doing it 20. It was developed by neurosurgeons because they wanted to get better results than surgery. The new research is being done at the University of Southern Florida, and the results are very impressive. And it's being done at the Department of Neurosurgery by neurosurgeons. The machine is also, the 𝑑RX-9000 system has also been researched by Harvard, Stanford, Mayo Clinic, and Johns Hopkins, also very impressive institutions. So let's talk about why and how this machine can help with a bulging disc. So if you have a bulging disc, what the machine does, it creates a negative vacuum pressure, and it actually will take that bulging disc and will reabsorb the bulging disc or the herniated disc, so it's no longer impinging the openings of the spine. And the way it does that, it creates an oscillation motion in the spine and actually creates a vacuum or a negative pressure. And that negative pressure acts as a vacuum and will take that bulge and reabsorb the bulge. Now, in the case of a degenerated disc, where this disc has become desiccated or dehydrated or flattened, and it's impinging all the nerves of the spine and the openings of the spine, the way the decompression system works is through that oscillation motion. It takes pressure off the muscles, discs, and the nerves, and decompression means that there's less pressure on the disc and that the disc has a negative pressure. Now, once there's less pressure on the disc, the blood flow can increase into the disc and start hydrating the disc. And that is kind of like pumping up a flat tire. And as the disc starts to hydrate, the disc will actually increase in thickness and return to its natural integrity, where it can maintain the shock absorbing ability and keeping the spaces between the vertebra so the openings of the spine are open. The third way the 𝑑RX-9000 that's FDA cleared to treat posterior facet syndrome is when these facet joints are rubbing on each other. And what happens is the disc has dehydrated and cannot maintain the space between the vertebra, and besides that the facet joints are basically bone on bone, the soft tissue within the joint, the jaw capsule, which is soft tissue, starts to include the openings of the spine. So the 𝑑RX, through that oscillation motion, will rehydrate the disc, create better space between all the openings in the spine. I'm Dr. John. If you suspect that you might have stenosis, please come into 𝒂𝒚𝒐 Physical Medicine. We'd be happy to read your MRI or send you out for an MRI and determine if you actually do have stenosis, and we'll help you treat it with the DRX 9000. What a pleasure, and I will see you in the next video.